The story of a novice medical student who received the system and saved lives and helped the injured, killing all sides. At first, I wanted to write a pure and refreshing article, but I tried writing a few openings and felt that they didn't fit my style. I am the attending physician in the respiratory department, working for 10 years, and I am about to be promoted to associate chief physician. Due to some reasons, the next year will be relatively idle. The idea of writing a novel arose. I want to write a refreshing article with a bit of depth. I am a fan of Ling Ran, a national forensic expert. Keywords of the novel. This doctor has a system without pop-ups, this doctor has a complete download of the system's TXT collection, and this doctor has the latest chapters to read in the system. Chapter 1. Report on regulated trainees. You are listening at novelfull.audio. Chapter 1. Report on regulated trainees. Looking at the huge doorplate of the People's Hospital of Central South Province, Gao Feng felt a bit confused. Gao Feng, male, 25 years old, tall 181 cm, just graduated with a master's degree this year and encountered some setbacks while looking for a job. The population base of Central South Province is huge, and the competition in the provincial capital is naturally more intense. Gao Feng studied at Xinjiang Medical College for his undergraduate degree, which is a well-known second-tier medical university in the province. He graduated with a master's degree from NMG Medical University. The undergraduate and graduate schools they attend are not outstanding, so job hunting is naturally neglected and cannot be done. Clinical medicine is like this, and provincial capitals require doctoral degrees, and even require the first degree to be from a 211 or 985 university. Fortunately, Gao Feng's family has relatively good conditions, but of course, it mainly relies on demolition. In the past few years, my family was fortunate enough to have been allocated several storefront houses, and my parents planted some big cherries in their own land. Overall, my income is quite good. Gao Feng has a younger sister who is not particularly outstanding in her studies. Currently, she is still struggling in a private 3-book school. After running many job fairs, the final results were not ideal. After considering all factors, Gao Feng decided to go for regular training. When he was studying for graduate school, there was no concept of integrating the 4 certificates. When he graduated, he lacked a standardized training certificate, which may affect his promotion to attending physician in the future. Just recently, the People's Hospital of Central and Southern Province was recruiting regulated trainees, and the confused Gao Feng became a proud regulated trainee, who is the bottom-level labor force in the hospital. Today is the day for Gao Feng's report. First, I went to 5 or 6 departments to collect various documents and badges, and then followed the crowd to the laundry room to collect white coats. When I returned to the dormitory, everyone's legs were weak, and several people were panting heavily. The hospital was indeed quite large. In the past few years of his postgraduate studies, Gao Feng, due to his somewhat cold personality, has been busy doing experiments and writing articles all day. He has always been a single dog, not troubled by love and affection, and his physical fitness is still decent. The time for breathing heavily is much shorter than others, which makes Gao Feng a bit proud. The dormitory where regulated trainees live is similar to when they were in school, with regular upper and lower bunks for people, and upper bunks for storing miscellaneous items. There are 4 people in a house, and everyone introduced themselves to each other. The oldest one is 35 years old, named Li Wenbin, who was sent by the county hospital for regular training. This type of training belongs to the nature of unit commission, and during the regular training period, he can still receive his salary normally. Wang Leifeng, 28 years old, from Shangqiu, has a similar situation to Gao Feng. He also graduated from graduate school and found a job that was not satisfactory. He decided to resign and come to the provincial hospital for standardized training. Next is Gao Feng, 25 years old, from Xinjiang. Wang Xianxian, 23 years old, from Huasyan County, Anyang, has just graduated with a bachelor's degree. As the big brother, Li Wenbin took on the responsibility very consciously. At his suggestion, everyone decided to go out and have a meal to strengthen their relationship. When leaving, Gao Feng also saw Li Wenbin taking a bottle of Wuliangya and a lotus seed from his backpack. "Wenbin, you have all the necessary equipment." Gao Feng was a bit surprised. "Brother, this is just a hobby, and I just want to be on the safe side of things," Li Wenbin smiled. As they were all newcomers, everyone was not familiar with the vicinity of the Provincial People's Hospital. As the youngest, Wang Xianxian directly visited a restaurant on Meituan, and everyone hurriedly killed him. It's a Xinjiang restaurant. It has to be said that people in Xinjiang really know how to eat. When Gao Feng was in college, he had a roommate who was from Xinjiang. Every time he came over during winter and summer vacations, he would bring a lot of delicious food with a variety of options. After a few drinks, everyone started talking a lot. During the conversation, it was learned that Li Wenbin, the elder brother, came out of Guipei to relax. He had just divorced. As a doctor in the neurology department of the county hospital, Dr. Li is usually very busy with work and not very worried about his family, so he was robbed of his home. He was furious and beat up his adulterer severely. The other side knew it was a mistake, but they didn't hold him accountable. As soon as he returned to the hospital, everyone gave him sympathetic glances. Wenbin couldn't help but feel a bit overwhelmed and asked to come out for training, leaving a green light all the way. Before leaving, the dean comforted him and said, "It's normal to have a bit of green in life. Don't worry, I've explained to everyone that I won't let them talk about you." "I fuck Nima, do I need you to explain it to me? Does the whole hospital know now?" Li Wenbin's mentality has collapsed. Everyone comforted brotherly. Wang Leifeng comes from Sui County, Shangqiu. He is a graduate student at Dalian Medical University and has worked in the digestive department of the second hospital of SQ City for 2 years. He felt that he was busy all day without much gain, and his salary and benefits were not good, so he decided to resign. His parents both work at the Sui County Finance Bureau, and one of his older brothers was admitted to the local power department last year, so there is no burden at home. Both of his parents wanted him to get married quickly, but unfortunately he couldn't get married after talking to 2 girlfriends, both of whom thought he was short in stature. Wang Xianxian is considered as Gao Feng's younger brother and graduated from Xinjiang Medical College. His parents are both doctors from Huaxian County Hospital in Anyang. After failing the postgraduate entrance examination, his parents asked him to come for regular training and return to the county hospital to work after the end. Gao Feng felt that his parents were supposed to be leaders or something at the county hospital, because it was not easy for undergraduate students to enter the hospital now. However, listening to Wang Xuanxuan's tone, he felt very relaxed. Gao Feng also explained his family situation and current situation to everyone, and everyone joked that he was a second-generation demolition worker. A group of people enjoy themselves harmoniously, and Gao Feng quite likes this state. Sometimes, when encountering strangers, they can chat for a long time. Everyone can always find various topics, but there is no desire to confide in familiar people. Due to tomorrow's enrollment, no one wants to leave a bad impression on the teaching staff on the first day. The old Chinese concept is to focus on the first time. Everyone stopped as soon as they saw the good news. After returning to the dormitory, Gao Feng took out the long-awaited 8th edition internal medicine textbook. Due to the fact that the first department of Guipei was respiratory medicine, also known as respiratory and critical care medicine, Gao Feng wanted to briefly review the manifestations of common respiratory diseases. He couldn't help but be afraid to ask questions since childhood. Leaning on the bed, as soon as he opened his textbook, Gao Feng suddenly felt a bit dizzy, and his mind went through a sharp pain before he passed out cleanly. Wang Leifeng, who went to the bathroom to wash, came back and saw Gao Feng lying on the bed. He shook his head and realized that his tolerance for alcohol was too poor. After an unknown amount of time, Gao Feng vaguely heard a loud noise. When he opened his eyes, he found himself in a white hall, empty everywhere. A mechanical voice rang out. Hello, welcome to the clinical doctor's workstation. I am your personal medical assistant, ID 9527. What the hell, workstation? Doctor's assistant. Gao Feng forced himself to calm down. Upon careful observation, Gao Feng did not see anything. After a moment of silence, he asked, "Hello, is anyone there?" The mechanical voice rang out again. "Hello, your medical assistant 9527 is in standby mode." Sleeping trough, what the hell is this? 9527, where is this? This is the workstation space I built, located within your consciousness space. Can I go out now? Gao Feng was a bit nervous. Of course, you just need to concentrate and sense the door to go out, and it's the same when you come in. Gao Feng concentrated his attention and indeed felt a portal emitting a white halo. As his consciousness leaned over, a slight dizziness struck. Gao Feng opened his eyes and found himself lying in bed, while the other 3 people in the dormitory were playing with their phones. Wang Leifeng curiously said, "Why did you wake up again? I thought you had drunk too much." Gao Feng replied with a smile. Focusing once again, Gao Feng felt the white halo emanating from the door, and eagerly leaned his consciousness towards it. However, this time it's different from last time. I seem to have 2 perspectives, and I can take into account both the situation in the dormitory and the situation in my mind, and can switch freely. This gives Gao Feng a novel feeling. 9527, are you still there? Gao Feng asked. How come this space is empty? Aren't you a workstation? That's because you haven't chosen the workstation layout yet. The mechanical voice finished speaking, and Gao Feng noticed 3 light clusters appearing in front of him, similar to the academician workstation he visited during his graduate studies. The layout is similar, but the decoration style is different. Gao Feng looked carefully and walked towards the second workstation, which had a large high-definition screen. If you take a look at some educational movies, the effects will definitely be amazing, and Gao Feng is not excited at all. Fingers lightly tapped the second light cluster, and a strong light immediately lit up in front of him. A sci-fi building suddenly rose from the ground, and when he regained his senses, Gao Feng had already stood in front of the big screen. Name: Gao Feng. Age: 25 years old. Gender: male. Physical fitness: 9, normal. Per capita: 10, spirit: 10, mastering medical skills. Primary consultation, primary physical examination, intermediate communication, internal medicine, diseases plus surgical diseases plus extra skill. Harmony: a slightly handsome appearance and a calm tone can help you communicate better with patients, although sometimes it may have the opposite effect. The details of internal medicine and surgical diseases can be opened later, and Gao Feng has seen many different diseases, some of which he has not even heard of. There's no way. Graduate students usually have to conduct experiments and do some miscellaneous work, so they don't stay for a few days in clinical practice. After exploring for a while, Gao Feng discovered some very practical features, which were the ability to input what was seen from the outside into this large screen. Scanning the Almighty King. Isn't it invincible for future exams? Gao Feng couldn't help but slap himself out of bed. Are you okay? Brotherly Wenbin asked with concern. It's okay, I'm ready to sleep, Gao Feng quickly replied. Thank you for your support. This is my first time writing a book as a newcomer. It's like giving it to everyone for the first time. End of this chapter. Chapter 2. The first day of respiratory medicine. You are listening at novelfull.audio. Chapter 2. The first day of respiratory medicine, also known as respiratory in critical care medicine, is a large department. From colds and fever, to tuberculosis and pneumonia, to lung tumors, all fall under its jurisdiction. Gao Feng, Wang Xianxian, and more than 60 trainees arrived early in the respiratory department with transfer notes. The respiratory department of the Provincial People's Hospital is located in Building 7 of the East Campus, with the 8th, 9th, 11th, and 15th floors all belonging to the Respiratory Internal Medicine Ward. Each ward has approximately 120 beds. In winter and spring, there are often queues for hospitalization, which is also related to the traditional Chinese concept of wanting to go to a large hospital for treatment, regardless of the severity of the illness. The secretary of the Respiratory Medicine Department is named Zhang Qian. Although she is not very old, she divided them into groups after handing over the class. Gao Feng went to the 9th floor, and Wang Xianxian went to the 15th floor. Everyone put on their white coats, signed their names, and quickly went to find their teacher. Gao Feng's teaching teacher is called Li Huizhen, with a doctoral degree and an attending physician. The director of this group also has the surname Li. I think I went to the outpatient department, but Gao Feng didn't see anyone. In addition, Gao Feng had a total of 4 students following Li Huizhen. She had just finished night shift last night and was feeling a bit down. After asking Gao Feng and his team for their names, she created a WeChat group and pulled everyone in. From the WeChat group, Gao Feng also learned the names of the other 3 people: Qi Nan Nan, female; Cheng Song, male; Hu Jiaran, male. Among them, Cheng Song is a graduate student currently studying, belonging to the type of training that integrates 4 certificates and is different from Gao Feng and others. Li Huizhen used the computer to go through the patient and started the ward round at 8:30 sharp. Gao Feng and others quickly followed behind her. There are 31 patients in their group. When Li Huizhen visited the patients just now, Gao Feng noticed that the types of patients include pneumonia, bronchial asthma, chronic obstructive pulmonary disease, lung cancer, and the cause of fever to be investigated. He did not see the rest clearly. Among the first 7 patients, Li Huizhen checked relatively quickly, indicating that the hospital stay was relatively long and the patient's condition was relatively stable. The 8th patient is a 41-year-old middle-aged male who entered while taking oxygen and breathing rapidly. Gao Feng remembers his name is Li Lei, and the diagnosis was written as bronchial asthma. Li Lei nodded as soon as he saw the doctor walking in. "Is it better?" Li Huizhen asked him to lie half in bed. "It's much better, there's still a bit of wheezing." Li Lei is a patient who came yesterday afternoon and has a history of bronchial asthma. He is usually allergic to lamb and crabs. This time I went out to have barbecue with my friends, and after eating lamb skewers, I triggered an acute attack of asthma. "Even though you know you're allergic to lamb, why do you still eat it?" Li Huizhen said she couldn't understand. Speaking of this, Li Lei felt depressed for a moment. This barbecue restaurant is near his home and he often goes to eat it. The lamb is all fake. Yesterday I went to eat again, and the boss felt like he was always here. He was his old customer, so he realized his conscience and gave me real lamb after finishing. He felt something was wrong. The taste was different from before and not as delicious as before. Li Lei was wondering, but after a while, he began to feel chest tightness, difficulty breathing, and a lot of rashes all over his body. My colleague was startled and quickly drove him over. After listening to his narration, the ward was filled with a joyful atmosphere. Li Huizhen instructed everyone to use a stethoscope to listen to the wheezing sounds in the lungs, warning them that in respiratory medicine, they must learn to see, touch, tap, and listen to the lungs. Auscultation is very important. After leaving the sickroom door, the army stopped and Li Huizhen asked everyone to stand in a row against the wall. The familiar questioning session had arrived again. You can tell that everyone seems a bit nervous, their necks are all shrinking backwards. Only Gao Feng remained relatively calm, which also caught Li Huizhen's attention. "Your name is Gao Feng, right? You look quite handsome. Can you explain the definition of bronchial asthma? Is that all? It's too simple." Gao Feng was somewhat disappointed. Bronchial asthma, abbreviated as asthma, is a chronic inflammatory disease of the airways that involves various cells, such as mast cells, eosinophils, T lymphocytes, neutrophils, and cellular components. Clinically, it manifests as recurrent wheezing, shortness of breath, chest tightness, cough, and other symptoms. That's great, then let's talk about the commonly used medications for asthma. Li Huijian clearly wanted to ask Gao Feng. There are mainly 6 types, including glucocorticoids, B2 receptor agonists, theophylline, leukotriene modulators, anticholinergics, and anti-IgM antibodies. Gao Feng finished his answer without pausing, and without noticing, Qi Nanan's eyes looked at him with stars. Li Huijian glanced at Gao Feng a few times before saying, "My basic skills are quite solid." "Did you graduate from that school? What educational background?" "NMG Medical University. Master's degree student." As the ward round continued, a voice rang out in Gao Feng's mind. "Congratulations on receiving recognition from the teaching teacher. Your fluent answer gave Li Huijian a slight recognition of you, and he rewarded you with 1 skill point." Looking around, everyone didn't react much, which made Gao Feng breathe a sigh of relief. Surprisingly, it can still add some points. It seems that this system is more powerful than I imagined. What aspect does this skill point apply to? Physical and mental health don't seem to be in great need for the time being. Gao Feng thought for a moment and felt that it should be added to the diagnosis and treatment of the disease. Due to being in the respiratory department, Gao Feng added this skill point to the internal medicine respiratory system pneumonia section, and the pneumonia diagnosis and treatment level suddenly became beginner level. Immediately, a large amount of knowledge about pneumonia treatment flooded into his mind, instantly gaining so much treatment experience, which made Gao Feng a little pleased. You should know that seeking medical treatment relies on clinical experience, and few patients will fall ill as stated in books. That's why some medical doctors don't even know how to see a doctor. Speaking of which, some patients always like to hang up so-called chief physician and expert accounts. Some directors and experts rely solely on scientific research and education for promotion, but seeking medical treatment is not their strong suit. If it is not a difficult and complicated disease, it is sufficient to call an experienced physician or associate chief physician, except for special circumstances. The last patient is a 14-year-old girl. Before entering the hospital room, Li Huijian specially explained to everyone, this patient is lung cancer and has multiple metastases, but the patient himself does not know. Remember not to discuss the condition in front of the patient. A 14-year-old late-stage lung cancer patient, which shocked everyone. Entering the ward, the little girl saw many people coming and quickly put on her hat. The older woman next to her should be the patient's mother, indicating that her mental state is not very good. Seeing the doctor coming, I tried my best to show a smile on my face. Li Huijian asked the little girl how she was eating. "Is she coughing badly now?" "I always feel nauseous when eating, and my cough has improved a bit," the little girl timidly replied. As she was about to leave, the little girl gathered her courage and asked, "Auntie, can I still treat this illness?" "Of course it's possible. You have pneumonia, but it's a bit too widespread. With more effort, you can definitely cure it," Li Huijian said with a smile. After leaving the door, everyone remained silent, and Gao Feng gently closed the ward door. "Let's go back and take a look at the lung adenocarcinoma area. Tomorrow we need to ask a question. You guys go familiarize yourself with the hospital's his system this afternoon, and I'll go for a consultation. If there's anything else, Gao Feng can call me." Li Huijian quickly left. End of this chapter. Chapter 3. The return of smokers with chronic obstructive pulmonary disease, COPD. You are listening at novelfull.audio. Chapter 3. The return of smokers. COPD with chronic obstructive pulmonary disease. A day in the respiratory department passed quickly. In the afternoon, Gao Feng familiarized himself with the hospital's his system and found it to be very smooth, much smoother than the broken system he had when he was studying for graduate school. I asked a teacher from the nearby group and learned that this system costs tens of millions and requires a significant maintenance fee every year. Sure enough, expensive things are useful. Everyone divided the patients into 4 trainees and 31 patients, and one person managed 8 of them. Chi Nan Nan first selects patients. She has just graduated from a vocational college this year and her foundation is relatively poor. She wants to manage some mild patients first. Gao Feng doesn't matter, and Ching Song doesn't have any objections either. However, Hu Jiaran had some objections. He discussed with Chi Nan Nan in a harmonious manner and said, "Nan Nan, you can also divide me into 2 lighter patients. My level is just as useless as yours." Chi Nan Nan couldn't help but roll her eyes. After everyone's division of labor was clear, they began to seize the opportunity to write medical records on the computer. The internal medicine departments of large hospitals have high requirements for medical records, and when they first arrived, everyone dared not be careless. At 5:30 p.m., Li Huijian appeared in the ward again and took everyone to check the patient again. "Get off work." Returning to the dormitory, Wang Xianxian was lying weakly in bed reading a book. When he saw Gao Feng coming back, he complained to him, "Respiratory medicine is so abnormal. Today, during the ward round, we were all being questioned. Everyone was like a shrinking turtle, scolded by the head of the group for a long time. How are you?" "It's the same. When we first arrived, everyone stumbled and it's normal to be scolded," Gao Feng comforted. Upon hearing him say this, Wang Xianxian became much more interested. As expected, what did he say? "Brother, I know you're not doing well, so I can rest assured." After a while, Li Wenbin and Wang Leifeng also returned. They were assigned to the cardiopulmonary function department, responsible for performing electrocardiograms on patients, and were still in the same group. After all, Li Wenbin has been working for so many years, doing an electrocardiogram is like eating bean sprouts like a tiger to him. The teacher who teaches is not as old as Li Wenbin, and he is very polite to him. After chatting for a while, the 2 of them became brothers and made plans to go drinking together the day after tomorrow. Gao Feng is also preparing to take a look at the task assigned by Li Huijian. Lung adenocarcinoma. Lung adenocarcinoma is a type of lung cancer and the most common type of lung cancer. Unlike squamous cell lung cancer, lung adenocarcinoma is more likely to occur in women and non-smokers. The incidence rate is lower than that of squamous cell carcinoma and undifferentiated carcinoma, the age of onset is younger, and women are more common. Most adenocarcinomas originate from smaller bronchi and are peripheral lung cancer. In the early stages, there are generally no obvious clinical symptoms and are often detected during chest X-ray examinations. Manifesting as a round or oval mass, it generally grows slowly, but sometimes hematogenous metastasis occurs early. Lymphatic metastasis occurs relatively late. Thinking of that 14-year-old girl, Gao Feng felt a bit uncomfortable. I don't know when humans can conquer cancer. The next day, the high wind started early in the morning, and there was no other way. There were too many people living in the dormitory building, and I couldn't even eat 10 minutes late. Today I met Director Li, who was leading the group. A smiling old man kindly asked Gao Feng where his family was from. Director Li also graduated from Xinjiang Medical College, which can be considered as a former senior of Gao Feng. Before the rounds could begin, Director Li received a phone call. After hanging up the phone, Director Li said to Li Huijian, "Lao Jia is probably suffering from chronic obstructive pulmonary disease again. I asked him to come and find you later." The process of ward rounds is very cumbersome. For each patient, the first step is to check the patient's examination and test results, then perform a heart and lung auscultation or other physical examinations, and then ask if the patient's symptoms have improved or worsened, detailed to 3 meals a day and bowel movements. If you encounter a few patients and their families who have a desire to confide, it's over, and you may not be able to give out the doctor's orders by noon after work. At this moment, the sweet-looking nurse sister will come over with a fierce aura and criticize you spiritually. As Guan Peisheng is at the bottom of the hospital food chain, he usually has to endure silently or complain behind his back. Today's ward round went smoothly, and soon Director Li's old Jia arrived at the ward. He is a 76-year-old man with white hair and beard. My son pushed him in a wheelchair, with a small oxygen cylinder placed on it. Mr. Jia saw Director Li and Li Huijian and raised his hand to stand up. His son quickly asked him to sit down. Gao Feng, come pick up this patient. Li Huijian said. Gao Feng and the patient's son helped the old man to the bed together, and the nurse sucked in oxygen for him. After inquiring, Gao Feng learned that Mr. Jia was an elderly respiratory patient. When I was young, I smoked more aggressively. Over 20 years ago, I was diagnosed with chronic obstructive pulmonary disease. Since then, I have been hospitalized once or twice a year due to chest tightness and wheezing. This time, it was also because I caught a cold a few days ago and felt severe chest tightness. I took oral medicine at home, but the effect was poor. My son quickly sent him to the hospital. Li Huijian conducted a lung auscultation on Mr. Jia, asked a few more questions, and then went to give medical advice. Gao Feng and Qi Nannan stayed behind to inquire about medical history and write case studies. At this moment, the system's voice rang. Please make a preliminary diagnosis of the patient. This is a bonus question. Gao Feng immediately gave the answer. Acute exacerbation of chronic obstructive pulmonary disease. Incorrect answer. What? Impossible, absolutely impossible. The answer is not comprehensive. After careful consideration, Gao Feng realized that the patient has been suffering from chronic obstructive pulmonary disease, COPD, for over 20 years and now has a condition of varicose jugular vein, which may be accompanied by chronic pulmonary heart disease. The answer is not comprehensive, it is recommended to conduct a detailed physical examination. The system's voice rang again. Old man, don't speak for now, I'll listen to you. Gao Feng took out his stethoscope. After a careful heart and lung auscultation, Gao Feng finally discovered the problem. Mr. Jia's right lung breathing sound was almost inaudible. Could it be due to pneumothorax? Congratulations to Dr. Gao for answering correctly, and reward him with the intermediate level of the heart and lung auscultation skill book. Gao Feng felt a little embarrassed and didn't even want this skill book. Returning to the doctor's office, Li Huijian had already given the doctor's order. Gao Feng went forward to take a look, but there was no chest CT or X-ray examination. The drugs used are antibiotics and asthma suppressants, as well as nebulized corticosteroids and B2 receptor agonists, which are standard configurations for patients with chronic obstructive pulmonary disease. Teacher Li, has Mr. Jia developed pneumothorax? Should we take him for a CT scan? Li Huijian hesitated for a moment and said, why do you say that? Does he have chest pain? Gao Feng said truthfully, he didn't say anything, but I just auscultated and found that the right lung breathing sound disappeared. Li Huijian reached out to grab the stethoscope from the table, and Gao Feng quickly handed her the stethoscope hanging around his neck. This is a brand new stethoscope, with a smoky appearance and a strong texture. It is different from the usual glamorous stethoscope that is colorful, tattered, and even lacks an earplug. Li Huijian noticed the brand name Littmann on it. In less than 3 minutes, Li Huijian returned and underwent a chest CT scan. Gao Feng quickly went to fill the oxygen bag and asked the nurse to seal the liquid tube. Mr. Jia's son is a bit nervous, and Gao Feng asked him to borrow a wheelchair from the nurse station. When he is busy, his nervousness will be slightly relieved. End of this chapter. Chapter 4. The Homecoming of Smokers with Chronic Obstructive Pulmonary Disease 2. You are listening at novelfull.audio. Chapter 4. The homecoming of smokers with chronic obstructive pulmonary disease. 2. The chest CT results were as expected, indicating a significant amount of pneumothorax on the right side. Nan, what do you mean by pneumothorax? The familiar questioning session has arrived again. I have been working hard to back down, why are you still asking me? Why should a woman embarrass a woman? Chi Nanan's heart is crazy roast. That, pneumothorax is the gas entering the lungs. Chi Nan worked hard to brainstorm. You're talking nonsense. Li Huizhen gestured to Gao Feng. Pneumothorax refers to the accumulation of gas into the pleural cavity, resulting in a state of pneumothorax. It is often caused by lung diseases or external forces that rupture the lung tissue and visceral pleura, or tiny air bubbles near the surface of the lung rupture, causing air to escape into the pleural cavity in the lungs and bronchi. It is more common in young and middle-aged men or those with chronic bronchitis, emphysema, chronic obstructive pulmonary disease, and pulmonary tuberculosis. This disease is one of the pulmonary emergencies, and in severe cases, it can be life-threatening. Timely treatment can cure it. Pneumothorax is usually divided into 3 types. Artificial pneumothorax, traumatic pneumothorax, and spontaneous pneumothorax. It's too simple. I am a systematic man, and I have recorded all the internal medicine books. Gao Feng remained calm in his heart. Young man, the foundation is solid. It's exactly the same as what the book says. The other group of teachers couldn't help praising. So strong. Cheng Song. I also want to pretend to be forced, Hu Jiaran said. Only you can, why not go to heaven? Chi Nan. Later, Gao Feng, you will take Nan to place a drainage tube for the patient. Have you ever done it before? Li Huizhen asked. A few times, Gao Feng replied lightly. Cheng Song and Jia Ran went to prepare things, while Gao Feng and Nan went to talk to the patient and ask them to sign. Li Huizhen quickly issued the order. Gao Feng, are we okay? This is my first time, I'm so scared, Chi Nan worried. It's you who can't do it, I'm a man, can't I? If it's not possible, it's also possible. Gao Feng comforted and said, it's okay, it's the first time. I'll be gentle, no, I'll just slow down. You can see clearly and come by yourself in the future. Quickly, everything was ready, and Li Huizhen drove Mr. Jia's son out of the hospital room. Everyone rushed forward. Thoracic puncture, abdominal puncture, and lumbar puncture are the 3 major punctures in clinical practice, and Gao Feng is also quite familiar and not intimidating. The sound of the system suddenly rang in your mind, and it was detected that Dr. Gao was going to undergo a thoracic puncture. You received a mandatory task. Perfect debut. The next day at work, your abilities were preliminarily recognized by the attending physician Li Huizhen. Now please use a perfect chest puncture closed drainage surgery to gain her further recognition. Now Gao Feng is facing difficulties. He thinks he did a good job on the chest piercing, but he probably won't achieve perfection. Dr. Gao, don't worry, the system will provide you with special training. No, it's a bit late at this time, isn't it? Gao Feng couldn't figure it out. The system will send you into the constant time-space, where the passage of time almost stops. Currently, you can enter once a day. Gao Feng regained his senses and found himself in a spherical space with many things that couldn't be called, and surprisingly, Mr. Jia was also here. Dr. Gao, don't panic. This is just a simulated human generated by the system, without any emotions, just for the convenience of your practice. The space perfectly reproduces real life objects, and Gao Feng allows Mr. Jia to position himself properly. Open it up. Unqualified wearing of gloves, 0 points, deduction points for non-standard needle insertion angle during local anesthesia. The guide wire touched an item outside the sterile label without paying attention to the principle of sterility, resulting in 0 points. The technique used for sewing is too unfamiliar, resulting in increased pain for the patient and points deducted. The overall operation time is too long, points will be deducted. So strict, I like it. Gao Fengxi said. Fortunately, he is the virtual Mr. Jia, otherwise he will always suffer. Finally, after the 97th operation, Mr. Jia transformed into a stream of light and disappeared. That man returned to the real world, his king returned. Mr. Jia felt a chill all over his body, and he always felt that the male doctor's gaze was a bit off, not gentle at all. Just as he was about to say a few words to ease the atmosphere, a sterile sheet covered his face. Don't move, I'm going to get anesthesia, said the male doctor with a cold tone, and the old man didn't dare to move. Li Huizhen also felt that Gao Feng was a bit different, this needle is so sharp to insert. This speed. Wow, it's in the guide wire, the skin has expanded, oh, the tube has been placed, I've connected the drainage bottle, hiss, it's fixed. Quick shooter, it's real. At this time, Qi Nan was still brainstorming and recalling the steps of chest piercing. As long as you can show off, sooner or later you will suffer losses. Qi Nan had already seen through everything. Let him pretend again. Hu Jiaran. No, you know everything. You can train a yarn. Cheng Song. Seeing the bubbles popping out of the drainage bottle, Li Huizhen couldn't help but praise, it's done well, even better than what I did. Skill points increased by 3. Congratulations to Dr. Gao for mastering the perfect chest puncture technique. Skill points increased by 3 all at once. Oh, don't be too simple. However, Gao Feng feels a bit dizzy at this time, and the system reminds you to strengthen your mental strength in a timely manner. The number and time of entering the constant time space are related to your mental strength. If the mental strength is too low, it can lead to a series of adverse reactions such as dizziness, headache, fainting, and in severe cases, it may also cause permanent brain damage. When the system detects that your body will be severely damaged, it will prompt you to exit in a timely manner. Of course, everything is subject to your will. Well, that's great, consider it. Returning to the ward, Li Huizhen gave everyone another detailed introduction to the steps of chest puncture. Overall, it was done perfectly, and everyone will follow this in the future. Li Huizhen took the Littmann stethoscope off her neck. Gao Feng thought she would pass it to him, but she didn't. She put it in her white coat pocket. Indeed. At noon, just as they were about to retreat, Li Huizhen stopped everyone and said, today at noon, Hai Di Lao is being treated. Hot pot is junk food, eating too much is unhealthy, but if it's someone else's treat, then leave. Hai Di Lao is 50 meters east of the entrance of the Provincial Medical University. The little sister wearing a hot pot apron is very enthusiastic, and many people like to go to Hai Di Lao for their birthdays. There is no other way around, the service is good, the atmosphere is good, and there are also people singing birthday songs, making it a joyful experience. As soon as he entered the private room on the second floor, a young boy wearing glasses welcomed him out, calling out teachers one by one in a very friendly manner. Qi Nan is a bit uncomfortable. I'm such a trash, I don't deserve to be called a teacher by others. Everyone arrived and started eating. Wrong, start teaching. Yes, that's right, it's just a lecture. The boy is a drug representative, responsible for several products of provincial medicine. The purpose of this meal is to give a lecture. No way, the company needs to assess. Gao Feng and others cooperated with him to take photos and sign. The boy is very happy, and today has been very smooth. 15 minutes, the process is over, open it up, open it up. Qi Nan ate foolishly and felt very sad when he returned to the dormitory. She herself is a bit low, 155 centimeters tall, and a bit baby fat. She was originally planning to lose weight, but ended up eating so much at noon. How to say that? Some things are very comfortable to do, but I regret it afterwards. However, the beef roll was delicious, and Chi Nan Nan let out another full hiccup. Gao Feng returned to the dormitory and also slept for a while, feeling a bit dizzy. He added 2 skill points to his mind, and in an instant, his mind felt cool and refreshed. Keep the rest for future use. Writing a book for the first time, Gaga is joyful. End of this chapter. Chapter 5. Tracheoscopy Examination Storm. You are listening at novelfull.audio. Chapter 5. Tracheoscopy Examination Storm. Today's ward round was calm, and the 9th bed still had a fever. Li Huizhen asked her to go for a chest CT scan. At the end, we asked a question about lung adenocarcinoma, and as we had previewed it in advance, everyone answered fairly well. Even Chi Nan Nan received praise and couldn't even see a smile in her small eyes. Mr. Jia has also recovered well. Currently, his chest tightness has greatly reduced and he is eager to remove the chest drainage tube. Director Li asked him not to worry and to endure in order to overcome the disease. While everyone was chatting in the office, 9 beds returned from their chest CT scan and gathered together to watch the video. Li Huizhen has a headache. She has been hospitalized in this 9-bed hospital for a week and still has recurrent fever. Currently, tuberculosis is not ruled out. But sputum acid resistance is negative, and the PPD test is also negative. I wanted her to have a bronchoscopy, but the patient is a bit old, 88 years old, and there is a certain level of risk. The family was also indecisive before. The patient's CT scan during this re-examination showed that the scope of inflammation did not decrease. Li Huizhen felt that dragging on like this was not a solution, so she asked Chi Nan Nan to call the family over and prepare for further communication. The old lady's son is named Wang Dali, and from his name, he is known to be very burly. He is taller and stronger than Gao Feng. When he saw him, Gao Feng remembered a song. His eyes stared like copper bells. The communication went smoothly, and Wang Dali also felt that his mother's constant fever was not enough. She had been in the hospital for a week now and had not spent less money. She decided to take the risk of getting a bronchoscopy to see what was going on. This patient is in the charge of Chi Nan Nan. She pulled Hu Jiaran to go to Wang Dali to sign a consent document for bronchoscopy. Gao Feng reads practical internal medicine books in the office, and sometimes relying solely on the system is not enough. He also needs to have a basic understanding, so that when the system imparts knowledge, he will not feel abrupt. At this moment, there was suddenly a commotion outside, and Chi Nan Nan rushed in. Gao Feng, go over and take a look. Wang Dali is going to hit Hu Jiaran, he said. What is the situation? Gao Feng was confused and exchanged a glance with Qing Song. Hu Jiaran is not the bed doctor of Wang Dali's mother either. If he wants to fight, shouldn't he also fight Chi Nan Nan? Qing Song was also puzzled. 2 people hurriedly went to bed 9, and Wang Dali was pressing Hu Jiaran by the window, just like pressing a little chick. Master Wang, don't get excited. If there's anything you can say, you can't do it. This was the persuasion from the bed nurse. Hu Jiaran, what are you doing? Wang Dali, calm down. Qing Song also quickly shouted. Hu Jiaran was almost crying and said trembling, it's none of my business, I didn't say anything. Gao Feng looked at Chi Nan Nan again. It turned out that when he signed, Chi Nan Nan was very responsible and explained to Wang Dali what risks might arise from doing this bronchoscopy. One by one, there were more than 20 risks written on it, such as sudden death, bleeding, pneumothorax, and hemothorax. The old lady listened beside her, her soul scared out of her wits, cursing her son for being unfilial and saying that she was doing this bronchoscope to save her life. Seeing his mother like this, Wang Dali was also anxious. Doctor, you didn't mention so many risks at first. He was very angry and didn't let go of Hu Jiaran. In fact, he wanted to hold down Chi Nan Nan, but he felt that it was a bit inappropriate for a strong man like him to attack a small carrot head. Coincidentally, Hu Jiaran was standing next to him. Anyway, they were all in the same group, and everyone was the same. This unlucky child, Gao Feng, is very speechless. Seeing so many people coming over, Wang Dali also felt a bit embarrassed. He was an authentic farmer with no malicious intentions. He was also anxious just now, and at this point, he also let go of Hu Jiaran. Knowing the causes and consequences of the situation, the head nurse quickly provided psychological counseling to the patient. A sound came to my mind, the system is going to cause trouble. Excuse me, Dr. Gao, do you think Wang Dali is sick? What? The high wind is a bit hazy. Wang Dali is just emotionally excited. What kind of illness can he have? Brainstorming is initiated. No results, Gao Feng decided to ask Wang Dali. Master Wang, how is your health usually? Gao Feng tried his best to be amiable. It's pretty good, both blood pressure and blood sugar are normal. Wang Dali was a bit puzzled. After thinking for a while, he said, it seems like I occasionally feel flustered, everything else is gone. Gao Feng conducted a heart and lung auscultation on Wang Dali, and his heart rate was a bit fast, 112 beats per minute, which is generally between 60.100 beats for normal people. Wang Dali still looks a bit eye-catching and easily agitated, shouldn't it be hyperthyroidism? Congratulations to Dr. Gao for answering correctly. Skill points +1. The diagnosis is clear, how should I tell Wang Dali? Will he get angry? Gao Feng felt uncertain and casually added this skill point to his physique. It felt like he was a bit stronger. After some consideration, Gao Feng decided to communicate with Wang Dali and said, Master Wang, do you know about hyperthyroidism? It is obvious that Wang Dali knows nothing. Hyperthyroidism, also known as hyperthyroidism, is a condition caused by the excessive synthesis and release of thyroid hormones by the thyroid gland, which leads to metabolic hyperactivity and sympathetic nervous system excitement in the body, causing palpitations, sweating, irritability, increased eating and bowel movements, and weight loss. Most patients often have symptoms such as protruding eyes, eyelid edema, and decreased vision at the same time. Do you mean I have hyperthyroidism? Wang Dali felt a bit angry again. You're cursing me for getting sick. Gao Feng said politely, actually, you can check your thyroid function. It's so convenient and not expensive to take advantage of being in the hospital. Wang Dali hesitated a bit and decided to go to the outpatient clinic. The doctor just now was too young and had no beard, so what he said may not be right. Nurse, which doctor's account should I use for hyperthyroidism? Wang Dalai, the guiding nurse, was busy with her feet on the ground and didn't even lift her head, saying, I'm going to the endocrinology department. Upon seeing Wang Dali walking in, Vice Director Hu of the endocrinology department sat up straight and must give such a sturdy man the most basic respect. Hello, is there anything uncomfortable? Doctor, can you show me if I have hyperthyroidism? Wang Dali felt a little uneasy. Vice Director Hu stood up and carefully looked at Wang Dali, asking, do you usually have a bad temper? Do you have any palpitations or easy sweating? My temper has always been very strong. After marriage, I feel better. Sometimes I feel a little flustered. I can rest for a while. I didn't pay attention to sweating. Vice Director Hu issued a thyroid ultrasound and thyroid function test to Wang Dali, and asked him to come back when the results came out in the afternoon. Wang Dali looked at the payment amount, which was not expensive, and breathed a sigh of relief in his heart. The inspection was done very quickly, and no one dared to cut in line when Wang Dali went to that station. A hurried middle-aged woman originally intended to push the door directly into the ultrasound room, but when she saw Wang Dali standing at the door, she suddenly became less anxious. Wang Dali looked over and even showed a smiling face. It's so ugly, Wang Dali thought to himself. The results of the afternoon blood test were also available, and Wang Dali quickly arrived at the endocrinology department consultation room. His wife was also a bit uneasy and insisted on following over to take a look. Your hyperthyroidism. Deputy director who gave a sexual response. Is it easy to treat? Is it serious? Wang Dali's wife was a bit worried. Don't worry, it's not a big problem. In your situation, you can take medicine and observe first. Deputy director who clicked on the keyboard for a while. He asked Wang Dali to have another cardiac ultrasound, as prolonged hyperthyroidism can easily lead to hyperthyroidism-type heart disease. If the problem is not serious, you can take methimazole first. If the effect is not good, then consider radiation iodine therapy and surgical treatment. If I had known earlier, I wouldn't have checked. Once I checked, I would have been sick, complained Wang Dali's wife. You understand nothing. Wang Dali was speechless. Fortunately, methimazole was very cheap, and Wang Dali bought several boxes in one go. The keyboard malfunctioned, seriously affecting my efficiency. End of this chapter. Chapter 6. Discussion of intradepartmental cases. You are listening at novelfull.audio. Chapter 6. Discussion of intradepartmental cases. Today is another beautiful day. At the handover, the director of the subspecialty notified everyone to come to the conference room at 2:30 p.m. for case discussion. 56 and 79 beds are not patients in the Gao Feng group. When the rounds reached bed 9, Hu Jiaran couldn't help but shrink her neck. Wang Dali saw Li Huijian and Gao Feng coming in and quickly stood up with a smile on his face. Is the doctor-patient relationship still very harmonious? Today, the old lady is going to have a bronchoscopy. After checking the room, Qi Nan took her to the bronchoscopy room. Li Huijian asked Qi Nan to watch inside. After all, the old lady is old and can call directly if there is any situation. Wang Dali's wife also sent a large basket of fruits to the office. Is eating apples in the morning easy to cause bloating? Hu Jiaran nibbled on it while writing her medical record. Hurry up and eat. If you don't eat in the morning, it will be gone in the afternoon. Qing Song also took an orange. There are so many trainees, how can they get enough points? At this time, Gao Feng is reviewing the medical records of bed 56.79, which is the patient to be discussed in the afternoon. 56 beds are a 69-year-old male patient who visited a local county hospital half a month ago due to coughing and blood in sputum. A chest CT scan was performed, and a mass was found in the left lung, suggesting lung cancer. A bronchoscopy examination was performed at the local county hospital, and no tumor cells were found in the pathological results. My family wanted to figure it out, so they came to the provincial hospital. Gao Feng looked at the chest CT, which showed typical features of lung cancer. The mass had lobulation, spicules, and pleural traction, as mentioned in the book. After arriving at the provincial hospital, the supervising doctor conducted another bronchoscopy examination on him. 3 days later, the pathological results came out. No tumor cells were found. Let's do a lung puncture, the supervising doctor has communicated with the family. 3 days later, the pathological results of lung puncture came out. No tumor cells were found. This is a difficult situation. Everyone said it was lung cancer, but after 3 attempts, no tumor cells were found. The patients are all in a hurry. If you want to shoot, just shoot. What does it mean to keep holding a gun against my head? Let this scare me. New task. Mr. Gu Maochang unfortunately has lung cancer, but the diagnosis seems to be not going smoothly. Please help him make a clear diagnosis as soon as possible so that he can receive further treatment. The system's voice rang out. It is indeed lung cancer. It seems that Mr. Gu Maochang is not very lucky. The positive rates of bronchoscopy and lung biopsy both exceed 90%, indicating that this patient is clearly within that 10% range. Repeated bronchoscopy and lung puncture can help improve the positive rate of diagnosis, but patients and their families may not be able to accept a second examination, which is related to their psychological resilience. Gao Feng decided to go see this patient. Upon seeing the doctor arrive, Mr. Gu, who was in bed 56, tried his best to show a smile, and the attitude of his family was also relatively gentle, indicating that their quality was quite high. Gao Feng first asked the old man about his diet and sleep, and then conducted a comprehensive physical examination of the patient. 2 enlarged lymph nodes can be felt in the left supraclavicular fossa, one of which is relatively shallow and has a diameter of approximately 8.9 mm, while the others are not found much. After all, what Gao Feng currently masters is only a basic physical examination skill. Can these 2 swollen lymph nodes be caused by lung cancer metastasis? Gao Feng fell into contemplation. If lung cancer patients progress to the advanced stage, they can experience metastasis from multiple parts and organs throughout the body. The most susceptible areas of metastasis include the following. Firstly, metastasis from mediastinal lymph nodes and from supraclavicular lymph nodes. Secondly, the metastasis of the adrenal gland. Thirdly, the metastasis of the brain. Fourthly, bone metastasis, and so on. The doctor in charge of 56 beds is called Hao Mengpei, a cute little girl. When Gao Feng returned to the office, he saw her nibbling on apples, which Hu Jiaran brought. Mengpei, there is an enlarged lymph node in the left supraclavicular fossa of bed 56, with a relatively shallow location. Can we do a puncture? Gao Feng walked over. Ah, what are you saying? Hao Mengpei was momentarily stunned. You shouldn't expect these trainees, after all, the first department to rotate. Basically, I don't know anything. Gao Feng asked Qing Song to go to the dermatology department to inquire about the possibility of performing superficial lymph node puncture and the price. Qing Song went directly to the nurse station to ask the nurse for help on the phone. This child has a sweet mouth and thick skin. The answer is. Can do it before 10 o'clock, 138 yuan. It's quite cheap. Hao Mengpei went to communicate with the patient's family and it went very smoothly. After all, it was just a simple operation and didn't even require anesthesia. Okay, let's start with the 56 beds and then take a look at the 79 beds. Bed 79 is a male patient with chronic obstructive pulmonary disease, COPD, who is hospitalized year-round. Before retiring, he was the leader of a cigarette factory in ZZ City. According to his spouse, smoking used to be very aggressive and impossible. We have the conditions. The old man has a long history of chronic obstructive pulmonary disease, combined with chronic respiratory failure and chronic pulmonary heart disease. He is wearing non-invasive ventilators outside the hospital. This time I also caught a cold and was infected. When the family brought it over, their consciousness was a bit poor. After checking the blood gas analysis, it was found that the partial pressure of carbon dioxide was as high as 103 mm of mercury, indicating type 2 respiratory failure. Anti-infective drugs were used for a week, and the old man's condition fluctuated. His diet was poor these days, and the supervising doctor gave him a gastric tube. Gao Feng carefully examined the examination and testing results from admission to the present day and found that there were a few days in between when the inflammatory marker C.reactive protein decreased. Yesterday's follow-up examination showed an increase again. The patient's consciousness has deteriorated again in the past 2 days. Talking to him loudly will respond, or he will be sleeping. Sleepiness is considered to be pulmonary encephalopathy caused by carbon dioxide retention. The patient's course of disease is too long, and he has been in a state of chronic respiratory failure. Carbon dioxide retention is not easy to correct. The purpose of this patient's discussion is to determine whether it is necessary to adjust and upgrade the use of antibiotics, and whether it is necessary to transfer to intensive care for invasive ventilation treatment, which is tracheal intubation. Gao Feng and a few others went to see this patient together. In the afternoon case discussion section, the trainees also had to speak up, and everyone had to prepare in advance. If they didn't understand, they had to search on Baidu in advance and then check the textbook. There were dry and wet rows during lung auscultation, and no other abnormalities were found. As I was about to leave the ward, the sound of the system rang out. May I ask Dr. Gao, what is the patient's breathing type? Respiratory type. After careful consideration, Gao Feng realized that the patient's breathing condition was indeed different from others. He seemed to breathe a few times, then stop for a few seconds, and after a short interval of time, start breathing again. At first, the high wind thought it was sleep apnea. Now I think this should be called intermittent breathing, which is common in patients with intracranial lesions, respiratory center failure, and other conditions. Thinking of this, Gao Feng quickly went to see the patient again. After talking to the patient's wife, he learned that the patient had a good consciousness a few days ago and even clamored for lamb soup. He has been sleeping quite well these past few days. I used a cotton swab to mark the outer side of the patient's foot and found that the left thumb was dorsally curved, while the other toes were fan-shaped, indicating a positive Babinski sign reaction. Is it possible that the patient's oral administration of antiplatelet aggregation drug aspirin is due to cerebral hemorrhage, and of course, it may also be due to cerebral infarction? Gao Feng picked up his notes and took them down. If it is a cerebrovascular disease, it is better to deal with it in a timely manner. Gao Feng communicated with the doctor in charge of managing the bed, and the male trainee wearing black-framed glasses clearly felt a bit flustered. I don't think so, I did a head CT when I was admitted and didn't find anything, he said. It may have happened during hospitalization, let's not take him for another one. This patient doesn't need money, Gao Feng coaxed patiently. The black-framed man quickly called his teaching teacher and replied that he would wait until the case discussion in the afternoon to discuss. Forget it, write the medical record. By the way, the system just rewarded a skill point. Gao Feng thought about it and added it to his physical examination skills. From beginner-level physical examination to intermediate-level physical examination. In an instant, many experiences flooded into Gao Feng's mind, and every perception of seeing, touching, tapping, and listening opened his eyes. If I had to learn this myself, when would I have to learn it? Life is about cheating. Brothers, please help collect what you see. Encouragement is needed when writing a book for the first time. End of this chapter. Chapter 7. Discussion of Intradepartmental Cases 2. You are listening at novelfull.audio. Chapter 7. Discussion of Intradepartmental Cases 2. The stewed noodles that Gao Feng ate at noon, authentic Hunan stewed noodles, with cilantro and pickled garlic cloves, even drank half a bowl of soup. During dinner, his mother called him and said that the big cherries at home were ripe. She asked him to take some time to go back and see who liked to eat, and gave him 2 boxes as a gift. Gao Feng calculated that the dormitory should have at least 3 boxes, and the department should be divided into 4 groups. Each group should have at least 2 boxes. These young trainees can eat them, just like pigs, not including me, Gao Feng thought silently to himself. In fact, gradually these trainees will realize that they can definitely eat the buffets of high-end hotels and conference centers in Zhengzhou several times within a year when they come to large hospitals for standardized training. Sometimes you can't even go eat if you don't want to. Many times, you are forced to go eat. Wrong, it's a meeting. After 3 years of regular training, many trainees did not make significant progress in their knowledge and their weight skyrocketed. Everyone arrived early in the afternoon, and the back row of the conference room was filled with people, while the front was empty for fish farming. At 2:30 p.m., the director of the sub-specialty department arrived with a group of chief physicians, deputy chief physicians, attending physicians, and resident physicians, and Li Huijian, the head teacher of the Gao Feng group, also followed behind. Seeing the empty front, Director Zhao of the Asia Vocational College frowned. The teaching secretary standing next to him quickly shouted, "All the students standing behind should sit in front of me." Director Zhao briefly said 2 sentences to the effect that discussing difficult cases is very important, and everyone can learn a lot from it. We need to do more in the future. Students should also actively participate and ask specific questions later. Everyone lowered their heads, like quails. Dr. Hao Mengpei, who is responsible for managing 56 beds, sat in front of the computer and began introducing the patient's situation. Express all the inspection results in detail. I can tell she's a bit nervous, and her words all have a vibrato sound. This case is not well written. Just as Hao Mengpei finished reporting, Director Zhao's voice rang out. Why is the current medical history so simple? Why not describe the specific situation of hospitalization in the county hospital before? The patient has a history of smoking, just write a simple sentence. How many years have they smoked? How many cigarettes do they smoke every day? Why not specify? The course of the illness is not well written. Why haven't the daily test and examination results been written in time? It looks like copying and pasting. If the teaching teacher has nothing to do, they need to review and verify students' medical records more often. How can they leave the department after writing them like this? Zhang Xiaoli, Hao Mengpei's mentor, gave him a look. Stupid. Hao Mengpei trembled with fear. Everyone went to see the patient together, and after half an hour, they returned to the conference room. Let's talk to a few students first, Director Zhao's voice rang out again. The scene instantly became very quiet. Hu Jiaran wanted to fart at this moment, but he held back. This might expose himself. Persist, you can do it, Hu Jiaran. The teaching secretary began to call the names and said, the boy in the plaid shirt in the last row, can you tell me what disease this patient has? I think so. The patient underwent 2 bronchoscopy and 1 lung puncture, but no cancer cells were found. Is there any other disease? I saw on Baidu and in a book that there is an organic pneumonia, could it be this? Well, this student also knows about mechanized pneumonia. It seems that he has taken Baidu seriously, but Baidu is not very reliable, Director Zhao thought to himself. Another lucky one was selected. She is a slim girl who looks pretty. She nervously said, I think we should still consider lung cancer. His initial symptoms were coughing, blood and sputum, and this lump also had pleural traction sign, just like what was written in the book. Many teachers laughed, and the girl blushed like an apple. Oh, why does this classmate look so calm? Good guy, you dare to look at me. The teacher is angry. He looks amazing, it's just you. Gao Feng stood up and said, I think this patient is still considering lung cancer. The patient has a long history of smoking, and the clinical symptoms are consistent with the manifestations of lung cancer. On imaging, the mass has lobulation, spicules, pleural traction, and a vacuolar sign can be seen on one level. The mediastinal lymph nodes on the same side are also enlarged. In the morning, during my physical examination, I found an enlarged lymph node in the patient's left supraclavicular fossa. I have already had the patient go to the dermatology department for puncture and pathology. I'm not sure if I can find anything. I think if the pathology is still negative, we should do another bronchoscopy examination. After listening to Gao Feng's speech, Director Zhao's eyes lit up for a moment. When was the pathological specimen sent? Director Zhao looked at Hao Mengpei. It was delivered at 9 o'clock. Director Zhao glanced at the teaching secretary, who immediately started calling. Hello, Director Lei. I'm Zhang from the Respiratory Department, right? Director Lei, we have a patient who has a lymph node pathology report with hospitalization number XXXXX. Could you please help us check if there are any preliminary results? Our director is asking. Yes, it was sent from the dermatology department. Preliminary consideration is that it is from a tumor or lung source. Are you sure? Oh, we are currently undergoing immunohistochemistry and the results will be available in 2 days. Alright, thank you, Director Lei. Alright. Yo, it's okay, that's settled now. This year's training doctor is okay, said a bald director, and Gao Feng remembered his surname was Pan. What's your name? Which school did you graduate from? Director Zhao was very satisfied with Gao Feng. He was tall, handsome, and performed very well. Hello Director, my name is Gao Feng. I graduated from Xinjiang Medical College for my undergraduate degree and went to NMG Medical University for my graduate studies. So I'm a graduate student, is my major in breathing? Director Zhao curiously asked. No, my major is gastroenterology. Okay, the young man has strong abilities, come on, Director Zhao praised. I really love to show off, Qi Nan said. Brother Feng is mighty, Hu Jiaran. Sure enough, pursuing a master's degree is the right choice. When I graduate from graduate school, I will definitely be able to do the same as him, Cheng Song said. Then the directors discussed the reason why no tumor cells were found in the 2 bronchoscopy examinations. It is still considered that the necrotic tissue on the surface was taken during biopsy. Some directors believe that frozen biopsy should be performed, while others believe that biopsy needles should be directly used to puncture the lesion for sampling. Finally, ROSE, also known as Rapid Cytological Interpretation Technique, was mentioned. Simply put, after taking the sample, the small sample is first specially made into a cell slide on site, and then rapid staining technology is used to observe under a microscope to evaluate the nature of the lesion. It can quickly evaluate the qualification of specimens and the type of lesions in various biopsy operations, and even preliminarily diagnose the pathological type of tumors, and continue to send high quality specimens to the pathology department, bacterial or fungal laboratory. This greatly reduces the probability of patients having to undergo a second invasive examination due to inadequate sampling. This patient has already undergone a bronchoscopy at the county hospital but has not been confirmed. Why hasn't it received enough attention since coming to our hospital? We have been developing ROSE technology for a long time, why didn't we use it for this patient? In the future, anyone who is not diagnosed clearly for the first time will have to undergo ROSE. Why didn't there be a detailed physical examination? Students can feel the swollen lymph nodes in the left supraclavicular fossa, but can't you masters and doctoral students touch them? Don't always rely on checking, it cannot replace meticulous physical examination. Director Zhao made a final summary. Continuing to discuss the second medical record, which is the 79-bed-old man. The black-framed glasses trainee carefully introduced the patient's situation, and this kid went out to improve the medical record, but Director Zhao did not catch the problem. After seeing the patient, the professor started calling for someone again. A classmate stood up and said, I think antibiotics should be replaced with the best ones. This patient's inflammation index is still very high, indicating that the inflammation is not under control. We need to increase our anti-infection efforts. What antibiotics do you think are more suitable for replacement? The professor asked again. Wary, is this what I should know now? The student was crazy in his heart and roast that I had just graduated and could not recognize the classification of antibiotics completely. Perhaps I knew I was asking for nothing, but the teacher called another classmate. Due to nervousness, this student stood up too aggressively and almost overturned the back table. The teaching secretary and Director Zhao frowned together. I think this patient needs to be intubated in the ICU. He is old, and his expectoration is weak. Inflammation is not easy to control. If he can be intubated, carbon dioxide retention can be quickly corrected. He can also do bedside bronchoscopy sputum suction, so that the patient can get better quickly. This student did his homework, and Director Zhao gave him a approving look. Gao Feng, come and talk about it, Director Zhao directly called out. I think this patient may have suffered from cerebral hemorrhage. Gao Feng. A buzzing sound of discussion began, accompanied by several doctors from this hospital discussing with each other. Director Zhao became interested and said, where did you tell that the patient had cerebral hemorrhage? The patient's breathing type belongs to intermittent breathing, which is generally seen in intracranial lesions and respiratory center failure. This old man's condition improved a few days ago, and the possibility of sudden respiratory center failure is relatively low. The patient has no history of cerebrovascular disease before, but I found that his left Babinski sign is positive. The patient has been taking aspirin and enteric-coated tablets orally, and I think it may be due to cerebral hemorrhage. As soon as the sound of the high wind subsided, Director Zhao turned to the doctors in our hospital. A director said directly, "Just contact an emergency CT to see if it's over." The teaching secretary quickly called and the feedback was quick. The imaging department said they can go down now. The black-framed glasses training boy called for 2 people to push the patient for a head CT, and everyone was sitting in the conference room waiting. At this moment, a middle-aged man walked in and nodded to Director Zhao and other directors. 2 people behind him pushed 3 small carts of fruit platters. Each trainee was given a box, and Director Zhao asked everyone to take a break. From a distance, Gao Feng heard Director Zhao say to the middle-aged man, "You're spending too much money, we're all sorry." The middle-aged man said, "The teachers are all working too hard. These are just trivial matters. I am also happy to do something for the teachers." Then there was another wave of commercial hype. End of this chapter. Chapter 8. Discussion of cases within 8 departments. 3. You are listening at novelfull.audio. Chapter 8. Discussion of intradepartmental cases. 3. The head CT results were quickly released, thanks to the upgrade of the electronic medical record system in recent years. After completing the examination in the imaging department, the clinical doctor can immediately see the film on the computer. The results indicate that there is bleeding in the right thalamus, and the amount of bleeding is not significant. Everyone looked at Gao Feng differently, and Director Pan, who was bald, came over specifically to ask if Gao Feng was married and if he had any potential partners to talk to. Director Zhao called for a chief physician from the Department of Neurology with just 1 phone call. The amount of bleeding is not very large. Considering the patient's condition, conservative treatment is recommended. The neurologist provided a consultation opinion. How about it? The bed doctor hasn't finished speaking yet. No, there's no bed. The head of the neurology department ran away, joking that this type of patient wanted to transfer it to me, but there was no door. In the future, everyone should be more meticulous in managing patients. People with sudden deterioration of consciousness like this should be given sufficient attention. Don't be misled by empiricism. Because this patient has respiratory failure, it is natural to assume that the patient's poor consciousness is caused by pulmonary encephalopathy. In the future, the teaching work of graduate students should pay more attention to clinical practice, and students should not be allowed to conduct experiments all the time. How could it be possible to see a doctor in this way? When Gao Feng pursued his postgraduate studies, he must have taken clinical transfer seriously. NMG Medical University thinks it's quite good. Director Zhao Balabala said a lot. Chi Nannan doesn't want to disdain Gao Feng anymore. It feels like the 2 of them are not on the same level. It's not bad to find him as a boyfriend, I suddenly thought to myself. Forget it, I'm just an ordinary person, unless Gao Feng is blind. However, I heard that some men like girls with baby fat, so Chi Nannan couldn't help but fantasize and peeked at Gao Feng. This little carrot head looks silly today, Gao Feng thought to himself. Ching Song is also a bit distracted, imagining that he could just be a high wind. I also want to kill everyone and attract the attention of the directors. The sound of the system rang out. You made a remarkable breakthrough in the first difficult case discussion in the department, and your professional medical knowledge and literacy even moved Director Zhao Xianqin. It's been a long time since you had a new employee who caught people's attention, and she even had the idea of bringing you under her command. Skill points increase by 10. Oh, Director Zhao is quite discerning, Gao Feng is complacent. Gao Feng, there will be a multidisciplinary consultation tomorrow morning. Can you go with me? Director Zhao said to Gao Feng as the meeting ended. Suddenly, a jealous gaze rushed over, and Hu Jiaran ran over. "Brother Feng, you're so strong," he said. Returning to the doctor's office, Li Huizhen couldn't help but praise Gao Feng a few words and even returned the stethoscope to him. She had already received the one she had bought herself, and attached a hang tag with her name and phone number written on it. "It's best for you to also write a name. I'll tell you, if the cardiologist sees it, I'll take it away from you every minute." "No, Teacher Li, are you really good as a black-hearted internist? Let's go for a ward round together." Li Lei, who is allergic to lamb and causes asthma attacks, has no more symptoms. Li Huizhen wants him to be discharged tomorrow, but he is unwilling and requests to consolidate for another 2 days. Consolidating treatment is quite mystical, and many patients like to have an extra 2 days of fluid infusion. Mr. Jia, who has pneumothorax, is currently in a relatively stable condition and is preparing to have his tube removed tomorrow. If there are no issues, he can be discharged the day after tomorrow. He told Li Huizhen to have his son make 2 brocade flags and bring them over when he was discharged from the hospital. No wonder his son came to the office yesterday and asked everyone what their names were. He dared to send a banner. This is more delightful than having someone treat Hai Di Lao 5 times. I must post on my social circle then. Hu Jiaran and Qi Nan had a deep understanding. The 14-year-old lung cancer girl's chemotherapy has basically ended and she can be discharged tomorrow. This is a beautiful little girl. Every time someone comes in, she puts on her hat to cover her bald head. Gao Feng smiled at her. Wang Dali's mother just had a bronchoscopy today. When Qi Nan returned, she told everyone that there was a lot of thick phlegm in the old lady's lungs, and some areas had dried into scabs, blocking the bronchi. No wonder the anti-infection effect has been poor. The doctor in the bronchoscopy room was very satisfied with the sputum and patient's experience. Qi Nan also took a lot of photos specifically. "Look at these sputum, do they look like the milk tea we drank?" she asked while pulling Hu Jiaran. "Get lost. Hu Jiaran." Just after work, Li Wenbin called and asked us to go eat together. "This time we will have crayfish, everyone AA." The store is located 200 meters near the provincial hospital. When they arrived at the store, the room was full of people. The boss added a table in a corner outside, which felt more comfortable than outside. The bright red crayfish quickly arrived at the table. Although the crayfish on the plate were messy, they were enough to arouse people's appetite. The emerald-like green peppers, scallions, coriander and the fiery red crayfish cleverly blended together, creating a natural atmosphere. The curled crayfish no longer spread their teeth and claws like before, like gentle little sheep. Break open the crayfish, expose the fresh and tender meat, and pair it with spicy soup. Take it in one bite, with a soft and tender taste, and then pair it with chilled beer. Absolutely. Midway through, I served another order of instant beef tripe, which had a smooth and delicate taste. It was dipped in chili and sesame sauce, and everyone had a great time eating it. During this period, everyone has become accustomed to the life of regular training, and their expressions are very relaxed. On the 15th floor, Wang Xianxian vividly tells the story of Gao Feng's killing in all directions during the discussion of difficult cases in the department. "You weren't there in the afternoon either, who said that?" Gao Feng said strangely. "When I went to the pharmacy to return the medicine, I saw the trainees on your floor," they said. Wang Xianxian. "You need to behave well. I heard that every year, there are only a few students who can stay for regular training. Li Wenbin is well informed, but at least you need a graduate degree, so boys have an advantage." "How did that say?" "In the hospital, girls are used as boys and boys are used as livestock. Many directors like to recruit livestock, not boys. Male nurses are also more popular than female nurses because in terms of family, women are more hardworking. Having children and taking maternity leave can easily lead to a shortage of staff in the department. Men don't have this kind of trouble. In many departments, if nurses want to prepare for pregnancy, they need to report to the head nurse in advance. It's your turn to prepare for pregnancy. Is it very abnormal? It is difficult to stay in the hospital. There are over 8.900 trainees in each class, and no more than 5 of them stay in the hospital. It is said that they need to have both abilities and abilities. This cannot be explicitly stated. Good food and drink, everyone return to the dormitory. Gao Feng has entered the system space and is preparing to allocate 10 skill points. Due to attending a multidisciplinary consultation with Director Zhao tomorrow, Gao Feng decided to add skill points to imaging skills. Popular imaging examinations include X-rays, chest CT, magnetic resonance imaging, and color ultrasound. Gao Feng's current level of film reading can only be considered as a beginner, and typical features can be seen, such as pneumothorax, cerebral hemorrhage, obvious intervertebral disc herniation, fractures, etc. A good clinical doctor's ability to read films is very important, otherwise you will only have to look at the reports issued by the imaging department. The imaging skills are divided into 5 levels, and the high wind is directly filled up. 3 o'clock was added to the mind, leaving 2 o'clock as a backup. Medicine is too complex, and even the best doctor cannot master all the diagnosis and treatment of diseases. The higher the level of hospital, the more detailed the division of departments. The cardiovascular disease areas of provincial hospitals are divided into hypertension department, coronary heart disease department, arrhythmia department, heart failure and cardiac rehabilitation department, cardiology department, and structural cardiology department. I don't know how many skills I can master by relying on the system, but Gao Feng has a small expectation in his heart. End of this chapter. Chapter 9. Multidisciplinary Consultation. Crazy, you are listening at novelfull.audio. Chapter 9. Multidisciplinary Consultation. Crazy arrived at the ward at 7:30. Gao Feng first reviewed the patients under his management, and the overall situation was pretty good. After handing over the shift at 8 o'clock, Gao Feng went to unplug the tube for Mr. Jia. Qi Nannan was very conscious of preparing the items, and now she has regarded Gao Feng as a superior doctor. This girl is very self-aware and has a clear positioning for herself. Pulling out the tube is actually very simple. Gao Feng explained the precautions to Qi Nannan and 3 others. 1. Aseptic operation is required to avoid infection. 2. Cut off the suture that fixes the chest tube before extubation, and hold the chest tube tightly to prevent slipping and causing pneumothorax. 3. Prepare Vaseline gauze, instruct the patient to inhale deeply, hold their breath at the end of forceful inhalation, and immediately remove the thoracic drainage tube. Almost synchronously, cover the drainage opening with Vaseline gauze, cover with sterile dressing, and fix with adhesive to prevent air leakage. The nurse next to the needle also knew about Gao Feng and couldn't help but say, "You know more than the doctors in this hospital." Gao Feng smiled at her and said, "You're so handsome." The little nurse was a little excited, but unfortunately, I'm already married, and the little nurse felt a bit self-deprecating. The removal of the tube was successfully completed, and Mr. Jia did not feel any discomfort. Gao Feng instructed him to ring the bell promptly if there was any situation. At around 10 o'clock, a skinny graduate student under Director Zhao came to look for Gao Feng. Gao Feng had never seen him before, but he could feel a hint of hostility towards him. The sound of the system sounded. Director Zhao Xianxin's respect for you has aroused hostility from his graduate student Li Yuliang. Task objective. How can fireflies compete with the bright moon? Please make this small character recognize the huge gap between themselves and you. The system will calculate rewards based on completion. Li Yuliang, it seems that you are not very kind to your friends. Multidisciplinary consultations are conducted in the conference room of the oncology department, and the patient is the mother of a city leader. The patient is 77 years old and has a history of hypertension, coronary heart disease and diabetes. 12 years ago, breast cancer was diagnosed and bilateral mastectomy plus axillary and inguinal lymph node dissection was performed. 1 year ago, he was admitted to the hospital because of fever, fatigue, bone pain and weight loss, and was diagnosed as breast cancer with bone metastasis. Chemotherapy and targeted therapy were performed, and patients were discharged after improvement. A week ago, the patient developed symptoms of fever and cough without any obvious cause. Initially, they did not pay attention and prescribed medication in the outpatient department. As a result, the symptoms became increasingly severe, and there were also chest tightness and poor appetite. After admission, a detailed examination was conducted, and the chest CT report showed multiple nodules in the lungs, excluding metastatic tumors, and multiple metastases in the liver. The patient had a fever, poor diet, and did not take hypoglycemic and antihypertensive drugs on time. Their blood pressure and blood sugar have also been poorly controlled recently. So the oncology department conducted a multidisciplinary consultation. Everyone took a look at the patient together, and the old lady looked very lethargic and thin. The family's reaction was getting worse and worse day by day. The old lady's son took a special leave today and came over, bowing to the experts repeatedly. Vice Director Zheng of the nutrition department spoke first. We need to insert a gastric tube and inject nutrient solution into it, otherwise patients in this state won't be able to fuss for long. Director Wang from the Medical Affairs Department gave him a wink. The family is also here, please speak politely. Hypertension Department. The patient's current blood pressure is still acceptable, let's monitor it dynamically. Director Chow of the Endocrinology Department is a charming middle-aged woman who is the most exquisitely dressed among everyone. She also wears a small and exquisite green watch on her hand, which looks not cheap. Behind her stands a graduate student. Director Chow believes that it is unrealistic to take oral hypoglycemic drugs for patients with so many underlying diseases, and insulin treatment is needed. You can wear an insulin pump for the patient, and we can adjust the dosage according to her blood sugar at any time. After Director Chow finished speaking, his gaze turned to Director Zhao and he said, I think the situation in the lungs is the most serious. With so many metastatic lesions, it indicates that the tumor has recurred again. You see, Director Zhao came to the consultation with 3 students, but it's impossible. They have a high level of expertise and recruit more graduate students than us every year. I don't know what Director Zhao can do for these metastatic tumors. Director Chow is not dealing with Director Zhao, Gao Feng can see it. Director Wang of the Medical Affairs Department gave a haha and said, Director Zhao, you have also expressed your opinions. Zhao Xianqin was very angry. Chow Yonghui, a despicable person, had been at odds with her when she first graduated and came to the hospital. Decades have passed, and their relationship is still on par. I'm getting in your way with a few students, you're such a shrew. Looking at the chest CT scan of the patient, Director Zhao was also a bit puzzled. The patient has been using targeted drugs all along, which is uncontrollable. There is no good way for the gods. Seeing Director Zhao's dilemma, it seemed that it was his turn to appear, and Gao Feng spoke out, this patient's lung is not a metastatic tumor, it should be caused by an infection. As soon as these words were spoken, several directors turned their gaze to Gao Feng. Director Chow, the endocrinologist, sneered disdainfully and said, when I say Lao Zhao, you don't care about your own students. Does he have the right to speak in this place? How do you usually teach? Director Zhao also thinks it's a bit inappropriate for Gao Feng to make a sound at this time, but hearing Director Chow say so makes me very uncomfortable. This is the person I brought, is it your turn to let this lesson go? The atmosphere in our department is quite good, and everyone is free to express themselves freely, unlike Director Chow who always judges seniority. Director Zhao bravely pushed back. Since you said it's an infection, tell me your evidence. I don't believe you can even watch movies as a graduate student. They all came from graduate school. Director Chow thought to himself, I haven't fully understood it yet. Can you see 1234? Director Wang of the Medical Affairs Department looked at Gao Feng and said, "Young man, if you speak boldly, it doesn't matter if you're wrong. Let's discuss, everyone can express their opinions." Gao Feng felt that Director Wang seemed quite good. Li Youliang's face turned red at this moment. "Boy, if you dare to speak up in this place, it's like seeking death. Gao Feng, I treat you as my opponent, but I didn't expect you to be just an SX. After all, you paid the wrong amount." I need to comfort him later, and Li Yuliang decided not to fall into the trap. That's right, a doctor, no matter how bad it is, it can go so far. Gao Feng was very calm, and Director Chao's words did not cause any emotional fluctuations in him. It was just a group of local chickens, tiles, and dogs. Gao Feng walked forward and enlarged the patient's chest CT. "Are everyone ready? Step back, I'm going to start pretending. Let me just talk about it from the perspective of chest CT. Firstly, this lesion must have spread through blood flow, randomly distributed, and can also be seen with vascular nourishment. Therefore, at first glance, it is easy to mistake it for a tumor. The lesion area in the lower lung is relatively large, and most of the lesions are located near the pleura, forming a small wedge shape. When you see this, you should think of pulmonary embolism. If it is caused by infection, it is also called septic embolism. So how do we distinguish whether it's a tumor or an infection? Tumor cells spread through bloodstream, are planted one by one and then split, 1 becomes 2, 2 becomes 4-inch, but no matter how it splits, the edges of the lesion are usually spherical in shape, relatively smooth and rounded. However, the imaging features of this patient are clearly not like this, it is triangular. Gao Feng slowly adjusted the level of the chest CT so that everyone can see it. There is also strong evidence. Look at the mediastinal window, there are several metastases on the patient's liver, but this area should be an abscess. Its CT value is different from others. Taking all factors into consideration, it should be a lung infection transmitted through blood." After finishing the narration and finishing work, unfortunately no one applauded, and Gao Feng felt a bit regretful. "Do you mean that you, as a student, are better at watching movies than in the field of imaging? I don't believe every word you say," Director Chao thought to himself. Director Wang of the Medical Affairs Department glanced at everyone and said, "Who is in the imaging department? Why haven't I seen anyone? Hurry up and call Director Li to send someone over." Soon, the head of the imaging department, Li Xianmin, arrived. There was no way, but the medical administration department had to sell its face. "Director Li, take a look at this film." Director Zhao's students are ignorant and question the level of reporting in the imaging department. Director Chao seized the opportunity and quickly applied eye drops. "This woman is quite annoying." Upon hearing these words, Director Li's face pulled down. Director Zhao quickly made up for the situation and said, "Students are just expressing their opinions. They are young and see very little, but they have no intention of questioning your imaging department." Director Li remained silent and began carefully scrolling through the computer. After a 2-minute CT scan, he retrieved the report. Director Wang saw that his face was a bit uncertain and spoke out, "Director Li, don't be too narrow-minded with the students. They are brave enough to express their own judgments, and this kind of behavior should be encouraged more. That's not the purpose of learning." Ah. No, there was indeed a problem with this report. Director Li felt a bit embarrassed. This should be an infection. The people below are not very skilled and have reported metastatic tumors, which makes everyone laugh. "What, can you speak? Director Chao is in a hurry, that's it, you cowardly man. Oh my, everyone makes mistakes. It's really like a metastatic tumor, and I look like it too." Director Zhao's pride couldn't be concealed in his words. "As a student, I usually like to pull CT scans, but this time I let him get it right. Only when Director Li comes over can I make a definite decision." Upon hearing these words, Director Li's face looked much better. "Director Chao, it's not me talking about you. You also need to let graduate students talk more and teach them more. Look at me, in the department, I let them speak freely. Director Zhao began DSS. Director Chao's face turned pale. Zhao Xianqin, what are you proud of? I'm not sure how much you weigh. Relying on students to support the scene is shameless. The patient's blood sugar is also high, and there is an abscess on the liver. Combined with the chest CT findings, it should be a blood-borne Klebsiella pneumoniae infection. Director Li spoke out again. Li Yuliang is completely numb. Is Director Li from the imaging department a popular actor invited by Gao Feng? The lines are all correct, it must be like this. It's also possible that Gao Feng is his son. As for why a person's surname is Gao and a person's surname is Li, it must follow his mother's surname. Is it very reasonable? Li Yuliang wants to go out now and tell everyone this fact. Gao Feng doesn't know about Li Yuliang's inner activities, otherwise he would definitely think that this little boy's inner play is quite rich. End of this chapter. Chapter 10. High wind, do you want to stay in the courtyard? You are listening at novelfull.audio. Chapter 10. High wind, do you want to stay in the courtyard? The second half of the multidisciplinary consultation is Director Zhao's stage, and since considering infection, antibiotics must be used. Which departments in the hospital are more proficient in antibiotics? That must be a respiratory department, they just play with antibiotics. Even the infection department has to move to the back row. The director of the general surgery department feels that he cannot come for nothing. He suggests that under the guidance of color ultrasound, a catheter can be placed to drain the liver abscess, so that both methods can be used together, and the treatment is fast. The multidisciplinary consultation was a complete success, and Director Wang from the Medical Affairs Department smiled sweetly. Perhaps due to his age, there were a few wrinkles on his face, and if he were a woman, she would lose face. Director Chao from the Endocrinology Department has been taking deep breaths, and she can't see Zhao Xianqin's husky appearance. The graduate student standing behind him also had an unpleasant expression and looked at Gao Feng with resentment. Li Yuliang is busy taking photos. First, let's take a group photo of the scene, and then take a few close-up shots of Director Zhao's speech. He also left photos of other directors speaking. Of course, it does not include Director Chao. This kid has a good eye, Gao Feng thought to himself. If he can earn the respect of his teacher, he must have outstanding qualities. Director Wang could not help but said to Director Zhao, you have a set of ways to take graduate students. Go back and send a copy of the material to the publicity department, and I will ask someone to get a push on the hospital's official account. The former deputy director of the nutrition department is very envious. He has only been promoted to vice high school for a few years and has no major research topics, and none of his subordinates have graduate students. I have to work hard, it looks stylish to take 2 students out. Deputy Director Zheng became more determined. Director Wang announced the adjournment of the meeting, and Director Chao was the first to leave the conference room. She didn't want to stay in this place for a second. The sound of the system rang out. Your performance in multidisciplinary consultations is evident to all, and almost all attendees remember your name. It seems that you have gained a bit of fame in the hospital. Skill points increased by 15. Your outstanding performance has made Li Yuliang realize the huge gap between himself and you, and he has now recognized his position. Skill points will be increased by 1. Director Zhao happily led Gao Feng and Li Yuliang back. On the way, Director Zhao had a desire to confide that Chao Yonghui has always been against me. Back then, 2 people came to the hospital the same year and both wanted to stay in the respiratory department, competing both openly and secretly. The old director is also a woman who doesn't quite like Director Chao's strong personality. Director Zhao, who has an average appearance, has gained her favor. Later, because the unit divided the houses, the 2 people got together again. The house was finally acquired by Director Zhao, and now the two of them have completely clashed. Why is she compared to me? I am still the Deputy Organizing Committee of the Respiratory branch of our Provincial Medical Association. She is just a member of the Endocrine Society, and we are not in the same class. Li Yuliang has never seen his teacher show off so prominently before. Gao Feng, where are you going to work in the future? Do you want to stay in the hospital? Director Zhao felt a love for talent. Are you taking me as your little brother now? Gao Feng said with a reserved tone, I haven't figured it out yet. I definitely want to stay as a provincial doctor, but I'm afraid my abilities may not be good. Hypocrisy, I'm sorry. Li Yuliang said. Young people, don't be so humble. You just need to have momentum at this time. Director Zhao liked Gao Feng more and more. If you want to stay, I'll tell you. It shouldn't be a problem. Li Yuliang's jealous separation of the quality wall. Thank you, Director Zhao. My first degree is only a second-tier university, and the graduate school is also average, which is probably not easy to manage. Gao Feng has seen the recruitment of provincial doctors, and his first degree is not directly passed through the 211-985 program. Last year, the respiratory department recruitment only required a doctoral degree. Director Zhao pondered for a moment and said, the recruitment process for critically ill patients is not that strict. You can go breathe in the sub-severe condition first, and then transfer to our department. It's not that difficult. Lao Yen, who breathes in the sub-severe condition, owes me a great favor. Now I'll tell him. Director Zhao was very efficient and quickly answered the phone. Lao Yen, isn't your department short of people? I can recommend an excellent one to you. First recruit your department and then transfer it back to me. What do you mean by this? Let's call you in first, and then transfer you back. Director Yen was a bit puzzled. My child's first education is a second-tier university, otherwise I would trouble you, Director Zhao said rudely. Anyway, I won't leave my own department. Just apply for an extra spot when the time comes, and Director Yen readily agreed. You can go back and get more resumes. The recruitment notice is expected to be released in July, and I will greet those who are familiar with it in advance, Director Zhao instructed Gao Feng. He has only been with you for 2 days, but I have been with you for 3 years. Li Yuliang exclaimed crazily in his heart. I don't know if I heard the shouting in Li Yuliang's heart, but Director Zhao turned to him and said, Yuliang, please prepare your resume and hand it over to me with Gao Feng. You can book it in the bronchoscopy room first, and I've already agreed with Director Yu. Looking back, endoscopes need to be separated. Next year, the bronchoscopy room will be under the management of the respiratory department. You should not disclose this matter, Director Zhao advised. Li Yuliang's brain was blank, and after returning to the respiratory department for a long time, his legs were still soft. I'm staying in the hospital now. It's difficult, isn't it? Li Yuliang couldn't believe it. You know, the 2 senior brothers from the previous class couldn't stay, one went back to their hometown and the other went to the 4th hospital. Li Yuliang's family conditions are very poor. His father used to work in a small workshop when he was young. In order to improve work efficiency, the boss removed the anti-twist cover. When he was tired of working, his father's right arm was twisted and crushed. My mother's health is also not good, she takes medicine all year round and has little ability to work. His older brother's academic performance is average, so he dropped out of high school before graduating and went out to work to support his family. Li Yuliang is the pride of his family, and he passed the 7-year undergraduate and master's program in clinical medicine at ZZ University. I always thought that after graduation, I could repay my family and earn a lot of money. Only when I entered the medical industry did I realize that I was too involved. A master's degree is just the beginning in a large hospital, and only then can a doctoral degree be seen in person. Li Yuliang has already submitted several resumes recently, and the New York Central Hospital in his hometown is willing to accept him. But in HN Province, only the first affiliated hospital and provincial medical college are the places that every medical student aspires to. Li Yuliang has always been diligent in front of Director Zhao, responsible for carrying bags, receiving water, and arranging schedules. Director Zhao is in the outpatient department and is responsible for writing electronic medical records and prescribing prescriptions for patients. When Director Zhao is inconvenient, he is responsible for answering the phone, recording it, and reminding Director Zhao to reply. He is responsible for coordinating with the conference liaison and writing speeches during provincial meetings. After the meeting, he will accompany Director Zhao back home. He is responsible for booking car and plane tickets, arranging accommodation for meetings outside the province, and also worrying about where to go when he has free time. Director Zhao likes to shuttle through various ancient towns. Director Zhao likes to eat rice-fragrant spring cakes. Director Zhao likes to drink coffee when he is tired, and even the little girls at Starbucks know Li Yuliang. Director Zhao doesn't like to eat coriander. Director Zhao's youngest son has just entered 2nd grade. Once, there was an urgent matter at home, and the nanny happened to have something to attend to. Li Yuliang was responsible for picking up the child from school. After a week, the children all fell in love with him. Normally, they don't allow KFC or instant noodles to be eaten at home. They follow Li Yuliang and take care of themselves. A classmate in the dormitory advised him, "Yuliang, let's not do it. Do you know that everyone says you are a lackey?" Li Yuliang thought to himself, "I don't want to do this either. Lying in bed would definitely be more comfortable. But my family conditions are not good, and everyone's studies are similar. I want to be in the eyes of the teacher, so I have to do this. Why does Director Zhao like to take me with him when he goes out? Isn't it because I am meticulous and have eyelids? Everyone says time is more precious than money, but I only have time, and I can only give it away." Director Zhao has never drawn a big cake for Li Yuliang before, and he no longer holds on to his expectations. As a result, this one came today. If anyone says in the future that I am a lackey, I will be barking, 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 Li Yuliang thought to himself. By the way, first give a call to the family, and Li Yuliang dialed his father's phone. Yazi, why did you call? Are you short of money? I'll get some for you in a moment. No, Dad, I have money in my hands. I just want to tell you some good news. I should be able to stay in the provincial hospital after graduation, as Teacher Zhao said today. Oh, that's great, you're really good. Your mother has gone out, I'll tell her when she comes back. Li Yuliang's father was overjoyed. Not yet off work, Li Yuliang didn't dare to say much and hastily hung up the phone. When Gao Feng returned to the department, Li Huizhen asked him if the multidisciplinary consultation was lively. "It's quite lively, and I also spoke up," Gao Feng told her. "It's a patient with a tumor complicated by infection. Everyone has their own opinions, and in the end, both the host and the guest are happy." Li Huizhen is a bit skeptical. She has held several multidisciplinary consultations in the respiratory department before, and every time there were arguments and sarcastic remarks. This time too, Gao Fengxin said. By the way, Director Li made an appointment with a patient in the afternoon who was coughing and hemoptysis. Gao Feng, please lead them to see first, and I will come back later. Li Huizhen explained and quickly went to the consultation. The matter of staying in the hospital has suddenly made such great progress, and Gao Feng is in a good mood. "Let's go have lamb soup at noon. This nearby restaurant is said to be quite famous, and it's my treat," suggested Gao Feng. "Oh, lamb soup, it sounds very greasy. I'm sure I'll get fat after eating it," Qi Nan thought to herself. But for some reason, his mouth naturally replied, "Okay. If I fail to lose weight, blame this Gao Feng." However, many people do say that this lamb soup is delicious and they have to queue up at night. Qi Nan decided to give face to Gao Feng. Ching Song and Hu Jiaran have already gone to change clothes, and it has to be said that men have much stronger mobility than women. Northerners like to drink lamb soup, and when Gao Feng went to school in Inner Mongolia, he usually drank this in the morning. No wonder there are too many people in this shop. The soup is milky white in color, with a pure texture, a bright color, and a blend of water and fat. It doesn't taste fishy or greasy at the entrance, and has a delicious taste with a long aftertaste. Even Qi Nan drank a big bowl and continued to argue until she became flustered. Ching Song will be attending an outpatient clinic with his graduate supervisor tomorrow, and let Gao Feng review the tests and results of the patients he manages together. Hu Jiaran reminded him that Mr. Jia's son would come to deliver the banner tomorrow. Ching Song thought for a moment and felt that this was more important than following the teacher to the outpatient clinic. I just finished my first year of graduate school and someone gave me a banner. I am also excellent. Ching Song thought to himself. If I'm not here tomorrow, I won't be able to take photos. Without photos, I won't be able to post on my social media. If I don't post on my social media, no one will know someone is sending me a banner. Is this okay? So he called his graduate senior brother and changed classes. Senior brother readily agreed, but he needed 2 more. Dog thing. Ching Song cursed. End of this chapter.